What's up, guys? Chris Irvin, the Cutologist here, coming at you from Tampa, Florida. And today I have my great friend, Dr. James, with me. Dr. James, can you go ahead and introduce yourself?
Absolutely. So my name is Dr. James, obviously. Chris and I went to undergrad together, which is how we know each other. So we've known each other for a few years now. So after I graduated from IC, went on to get my doctorate. So I got a doctorate of chiropractic from Logan University in St. Louis. After that, I spent a year in private practice in Northeast Ohio. That's when I really started to see that, there was a big nutrition gap. So the amount of nutrition, we get a fair amount in school, and there was a big gap. Like patients who, would come in, ask about supplements, they would ask about, what they should be eating, and the level of knowledge was just not there for what I assumed people were learning these days. So that actually got me into the field of nutrition even more. Wrote a book about it, just, like a patient guide. The book is really meant to be just for the patients, to give them like the bare bone basics of carbohydrates, proteins, fats, all that. So that's when I started working on my master's. So finished my master's in April of last year with a degree in nutrition and human performance. Finished that, started working in August at Grayson University in Lamoni, Iowa. So love teaching. Absolutely love teaching, right? So most of our students are going into a healthcare field of some sort, and because it's such a broad interest, right? Everything from athletic training to PT to OT, chiropractic, exercise science, whatever it is, giving them that base knowledge now that they can then take on, to their clients, that's really rewarding. Mm-hmm. And then just 3 weeks ago, I finished up working on a diplomate. So diplomate is kind of like your specialty, if you want to specialize in something. So just like an orthopedic surgeon is an orthopedic specialty, I specialized in nutrition and got my diplomate from the American Clinical Board of Nutrition. So that leads us to today.
Well, congratulations, man. That's a huge one right there. That's awesome that you're doing that. You've been the last few years. You've just been cranking out the certifications and the degrees. I feel like.
Right? And I feel like I'm finally done. Like I don't know what other degree I could possibly get at this point.
Well, that's awesome. One thing that you said in there that I wanted to touch on when you kind of talked about like the little bit of the gap in the knowledge of nutrition. Is it when you were going through school? Did you notice that it was because when I went through school, all of my things were in nutrition. So, my undergrad had a decent, it was biology with exercise science, so there was a little bit of nutrition, but then my master's was nutrition science, so we covered a lot of nutrition.
Right.
But for when you were going through school, was it that you guys weren't necessarily covering nutrition, or was it that like the information was outdated, or what was going on?
So if you look, right, so I see some companies, and just had a colleague this morning telling me about another supplement company out there that he had been approached to, right? He'd been approached by this company. They had said, well, we have MDs that endorse us, and nothing wrong with MDs, but MDs get very little nutrition in med school. Chiropractic, we got a fair share. We had 3 or 4 courses in it, but it was nothing compared to a master's in nutrition. So just like your degree, right? So your degree was nutrition based. So that's what our master's was. So I don't think it was necessarily outdated information. I just think you can't cover that much stuff in just 3 courses, right? You can't just cover. I had a whole course on the gut microbiome. A whole course, 15 weeks. That was perhaps one of the best classes I ever took, just because I had never fully understood, the gut-brain axis, or how what we put in the gut really affects us neurologically. So because you can, I guess, specialize and take courses in more unique aspects, it's not just a general nutrition. Like right now I'm teaching a nutrition course. That's great, right? But I feel like I have so much to offer.
Yeah. We're
trying to create more nutrition courses. Just because you really can't do justice in one course. And so then to think back, so while my classmates in the chiropractic degree, had 3 or 4 courses in nutrition, 3 or 4 courses in clinical nutrition on how to treating the, patient and how to incorporate that nutrition to get a better outcome. There are some MDs, DOs, even probably some DC schools that just don't focus enough on nutrition. And you know, it really is what it is, but that's all the more reason to try and use platforms like, you know, social media to get the word out there.
Right.
It's not necessarily groundbreaking research that I, you know, make posts about or share posts a lot. It's just information that I think is so great. And unfortunately, most of the population can't handle, you know, can't soak up everything in one 15-week semester. So they need these little tidbits. And I love tidbits. Like,
Yeah.
you know, one thing a day, two things a day here, you just learn something. By the end of 30 days, if you followed you, right, on Instagram, that's 30 days of material that they didn't have before. So I think it's just a matter of finding a starting place and going from there.
Yeah. Yeah, I like that. I think that's something I've been thinking about a lot too, because, you know, within the last probably month, I've had two things happen with doctors that I thought was kind of fascinating. One was my grandfather was visiting his primary care, and they were just kind of doing a checkup and stuff. And I had recently recommended for him and my grandmother to both take CBD oil because for a lot of different reasons, I thought that it would be beneficial for them to take. And I kind of told him, I was like, you know, talk to your doctor about it. And, you know, this is me, you know, I live in Tampa, Florida now. I've been down here for a while. I'm more used to people knowing what that is. You know, CBD is big down here. You know, well, it also helps that, you know, medical marijuana is available down here as well, which it is up in Illinois too. But, you know, back in small town Illinois, my grandpa had to call me when he was in the doctor's office, and because the lady, you know, the lady got on the phone, she was like, "Is it CDB, what is it?" Yeah. And I was like, "Oh no, you've never even heard of it before." Right. So that one was fascinating to me. And then the other one that was fascinating is I was actually talking to a rheumatologist last week, and incredible doctor. Really, really liked what he had to say. And what I thought was really interesting is when he was talking about rheumatoid arthritis, and he was saying how, you know, there's a lot of pro-inflammatory foods. There's a lot of things that you can be eating that can be promoting this. But he touched on it very briefly. So he just kind of went like, you know, nutrition is a big thing. Things like sugar and simple carbohydrates, they can be pro-inflammatory. And then he moved on. So I was excited because it was the first time that I've seen the first time that a doctor had actually given some sort of nutrition insight into a condition. Right. I loved it. But the fact that he brushed over it so quickly, despite the fact that I think, especially in something like rheumatoid arthritis where inflammation is the key thing, I think that the diet can play a much bigger role. And I think that most times we're looking for, in situations like this, we're looking for bandages or patches, what we can do to treat the symptoms rather than getting to that root cause. So, and that's kind of what I want to talk to about with you today. So for those of you who don't know, Dr. James' specialty, it's funny because you already talked about taking that 15-week course in gut microbiome. Dr. James' specialty is in food sensitivity. So, or at least I always say that I consider that to be your specialty because you know so much more about it than me. But can you tell them a little bit more about food sensitivity testing?
Yeah, so food sensitivity. So when we talk about food sensitivities, right, we're not testing the immediate IgE immune system reaction. So a typical type 1 sensitivity, right, IgE, that is, say, your shellfish or your peanut allergies, right? When you get around them, your throat starts to close, you may have anaphylaxis, right? Difficulty breathing. That is not what we're talking about. What we're talking about is the delayed immune response. So typically you'll hear a lot about IgG, right? IgG testing. There's still some maybe debate out there about it just because it's fairly new, really understanding it. But for the most part, it is generally accepted that, and I just read the stat actually just a few days ago, 60% of the population has some sort of sensitivity and allergy. So again, when I say allergy, I'm using it in the term of food sensitivities, not immediate reactions. So 60%, right, will have some sort of reaction based on what they're eating. Okay. So what does that mean? What does it mean that your body's reacting? So you touch base on the inflammation aspect. So inflammation, like if you look at the top 10 killers in the United States, right, you see heart disease on there a couple different times, heart disease, stroke, right, all that stuff. There was a stat that I read that almost 80% of everything that we're treating here in the United States could come back and be linked to an inflammatory response, to inflammation. And
Yes.
so, it's kind of like which came first, the chicken or the egg. And, depending on what specialty you're in, you'll have different debates. And it's all, appropriate debates. I mean, I understand it's not the end all be all one way or the other. Um, but the reason I chose chiropractic, right? I was a paramedic before, so I am not anti-medicine, anti anything like that. But when you try and tell me that you need a statin for the rest of your life because you can't go to a conservative diet approach first, I have issues with that. And
Right.
so let's look at your diet for the inflammation trigger, right? There are plenty of drugs that you can take to try and lower the inflammation. I don't want to take pharmaceuticals as a first response. Not saying there's
Right.
not a valid option, but that's not where I want to start. So with food sensitivity testing, what we do is, we take a little drop of blood, about 20 total, right? So you prick your finger almost like a diabetic. We check their blood sugar. You put these drops of blood on a specialized card. You mail that to the lab. And what the lab does is they run testing on it, right? So I'll get this report back that says, people, dairy's a huge one. I mean, I've heard you talk about dairy before, like if you want to do an elimination diet, dairy and eggs, certain tree nuts. So there are certain triggers that I expect, right?
Mm-hmm.
Depending on who you listen to, like you can hear different things about dairy. Like we're one of the only species to drink another species milk, right? Do you
Yeah.
eat dairy? Should you eat dairy? I just watched a documentary the other night and the guy was talking about how we're literally drinking, baby cow growth hormone. And I get it. And I really don't, wherever you want to be on that spectrum is fine. If I told you I didn't eat cheese, that'd be a lie. Like I love cheese. So
Mm-hmm.
obviously, even though I watched it, I'm still very much a dairy lover. But at
Yeah.
the same time, when I got tested, so I had been doing keto for about a month and had lost maybe 7 pounds. I mean, I was excited. Like,
Mm-hmm.
that's 7 pounds. I did food sensitivity testing and dairy was off the chart for me. So, I mean, I do react to dairy.
Mm-hmm.
And so that to me was my weight loss resistance. So that's why. So when I removed that, within 2 weeks, I had lost 14 more pounds.
Wow.
So I had completely gone a month with 7 and in 2 weeks of just cutting out, what I was sensitive to, 14 pounds. So that
Holy
was
cow.
huge. And
Yeah.
then, and when clients come to me, most clients, when they come, it's almost like a last resort. Um, Too much of medicine nowadays is looking at what's on the piece of paper, right? So your lab test looks fine. This is fine. This, MRI came back fine. Absolutely nothing is checking out medically. And so what does your doctor say? Oh, you're fine. What do you say? I know I'm not fine. Like I feel these symptoms. I feel this. What's going on? And some may jump to, it's psychogenic in nature. You're just making it up in your head.
Right.
What I find is that a lot of people just have these hidden sensitivities. Um, and, and, and once you remove the foods that your body doesn't like at that time, you start to bring down the inflammation. What happens when you bring down inflammation? You bring down the symptoms. What happens when you bring down the symptoms? Your body starts functioning properly again.
Mm-hmm.
And so that's really to me the importance of it.
Yeah. And you know what? I think something interesting that you talked about is something that I get all the time, like the chicken and the egg thing with inflammation.
Mm-hmm.
In my opinion, I don't think that it really matters because we know that the inflammation is there. Like you said, all of our most common chronic disorders, things like, Alzheimer's, heart disease, cancer, and even so like, we're even seeing things with, like PCOS and all these different things. Inflammation is definitely prevalent. And we know that inflammation can help progress a lot of these conditions
Oh
too.
yeah.
So regardless of if inflammation is the cause of the condition, if it's there and it can help progress it, then it's something that needs to be taken control of. And I think that's always something that I've said with cancer research is I think that a lot of times people argue so much about what comes first. Is it damaged metabolism or is it genetic alterations? But really, it doesn't matter because if damaged metabolism is there in cancer and inflammation is there in these different conditions, then that's what we should be treating. And I think like another thing to kind of touch on that I really like that you said is like I think a lot of times people take these pharmaceuticals as the first approach, and
Yeah.
it's because I think that people don't have faith in diets. People don't have faith in, I think a lot of times when people look at the foods they put in their body, they're only thinking about what that does for them aesthetically. They only think about, is this going to improve my body composition? Am I going to get fat or am I going to lose weight from eating these things? But nobody's looking at what's the overall picture of your health look like from when you eat these foods. So what would you say is the most unique thing? Because obviously we know dairy is a trigger. I've heard about eggs being triggers. Nuts can be another common thing. What else have you seen that you've been blown away by that people were sensitive to?
So every time I get a new set of results in the mail, I mean, it's like Christmas for me. It's like opening a Christmas present, right? Because I just want to see what's going on.
Yeah.
And so I have seen everything from onions and peas, right? Kidney beans, green beans are big. There was a patient. She had her second baby, right? So she had her second baby, and she had 20 pounds of baby weight that she just could not get rid of, right? And so when you want to lose weight, what do you eat? You eat grilled or baked chicken with spinach, right? You just try and put yourself on such a low restricted calorie diet that you're like, okay, surely I'll lose weight. She wasn't budging.
Mm-hmm.
So she got tested, right? She got tested. The results came back that chicken and spinach were just off the charts for her, right? Her body was she was consuming so much of it that her body was just reacting heavily. She cut out chicken and spinach, and within a week she was starting to lose weight again.
Wow.
And then I've had a lady, and this is one that I'm actually going to write up and publish, just because the results, some of the other evidence in the literature about migraines, right? How are migraines? A lot of people suffer from them. If you've never suffered from a migraine, you don't understand what someone is dealing with.
It's debilitating.
But she reported that she had a migraine every day for the last 8 to 10 years. I mean, every day at some point. And she just began to live with it, right? So we did the testing. Of course, dairy and a few other things were on there. And once she removed those foods, after a month, her headaches were down to 3 times a week, right? She was blown away.
Mm-hmm.
After 6 months, she was maybe having a headache once every month. So just understanding, and that support, I mean, there's articles within the Journal of Migraine, like there's a whole journal on migraine that support that. They support red wine being a trigger. They support dairy being a trigger. But I've seen everything from onions to peppers to grapes to pineapple. Pineapple's a big one. Which
really?
I was hoping when I did my food test, quite honestly, that every single fruit would come back because I didn't care. I wasn't eating fruit.
Yeah.
And of course, it wasn't.
Yeah.
So I was kind of bummed by that. But really anything. I've had a couple people who tested with nothing, right? So when they take the test and nothing comes back, they feel like, crap, I just wasted money. And it's not that at all. That tells us a lot. That tells us that we need to be focusing somewhere else, and that just gives us a better game plan. Mm-hmm. Whereas I've had several people who really test everything. And when you test everything, that's a good sign of leaky gut, which I'm sure, I'm sure your listeners and viewers will understand what leaky gut is if they've, been around keto for a while and listened to a lot of podcasts. Leaky gut is really a real thing, that I've seen. So, every test is different, which is the cool thing about it. I've seen coffee. I gotta be honest. If coffee came back, I don't know what I would do. I would be hurt.
I'd ignore that one. Just cross it off the list. I didn't see that.
It never happened.
Now, one thing I want to ask though, and I kind of have a take on this, but I want to get yours first. I think some people are going to ask that question. Well, what does when you get these test results back, how does the factor that you're eating a lot of these foods anyway, how does that play into the test results? Like if you're eating a lot of, like in the case you just said, she was eating a lot of chicken and a lot of spinach, and that came back as what was pro-inflammatory, versus yourself, you don't eat fruit and fruit didn't come up on that test result. How does the fact that like what you eat play a role into these test results?
Well, fruit did come up. I mean, there was some fruit. I mean, I wanted the whole category of fruit. just
Okay.
because I knew I could avoid the whole category of food.
Right, right.
Um, so the way it works, there's a couple different ideas. There's really not um, an accepted mechanism, right? So anytime you're talking about the physiology of anything, and you've gone through, your masters, and I'm sure you've had hardcore exercise phys courses,
Hmm.
right? Anytime you talk about the physiology or the mechanism of how something works, right? What you're trying to do is you're trying to trace it back, right? That's a lot of cancer research. So a
Yeah.
lot of cancer research is trying to figure out what can we turn off in terms of gene. Is there a gene we can turn off that will stop the cancer? Well, the problem is you turn off one or two more is going to activate. So finding the mechanism, finding the pathway is really difficult.
Hmm.
So with that being said, so in terms of food sensitivities, there's not an accepted pathway,
Hmm.
right? Different things can trigger. One thing is if you eat something 5 times a day for the, 4 months, the same thing, that buildup almost overwhelms the body. The best way I describe this is anybody who has ever watched um, The Price is Right. So on The Price is Right, they have this little guy, the mountain climber, who will climb, he will keep climbing, and all of a sudden he hits the edge and he falls off, right? That is kind of how I imagine it within the body, right? So you're fine at some level, you're fine, you're fine, you're fine, but over time, when you keep eating the same thing over and over and over, your body can almost build up like a resistance to it. And it just hits that tipping point and it's over the edge. So the idea is that we can remove that food. When we remove that food, right, whether it's for 3 months, 6 months, whatever it is, I always like to reintroduce the food. So this, that's the big thing. I don't want you to think, um, that you can never have this food again.
Hmm.
Um, because that's what some people are worried about.
Right.
I think you're doing yourself a disservice because it's just a matter of, you've eaten too much and we can remove that. Now, this, on the same side of that, so if you start to reintroduce foods and your reactions come again, right, that probably tells you that you do have a sensitivity to that food and that you should avoid it.
Hmm.
Um, so, the lab that I use, they recommend retesting every 6 months. Typically, I find that by the time we can retest all the food that we removed, it's about 8 to 12 months. And it's
Okay.
not even so much that you have to retest. The fact is, these new symptoms or these same old symptoms will start to creep back in. And
Hmm.
when they creep back in, you're like, I know what this is now,
Right.
right? And instead of trying to do the elimination diet, because an elimination diet, while it's cheaper, it's time consuming. And
Right.
for anyone who's trying to pinpoint a particular food, that can be hard. Plus, an elimination diet, like the foods that you're supposed to start out with by eliminating, that's a big, vast portion of your diet. So
Right.
if it's restrictive, no one wants to do it. If it's restrictive and people do want to do it, they usually fall off, right, after a certain amount of time. So typically what I find is like with food sensitivity testing, you can get your results faster and you kind of have a game plan.
Hmm.
Now, even then, there's some foods that aren't tested and you can do a food challenge. So you can challenge that food, meaning you can, once you're in hopefully a state of lower inflammation, right? You're going to be able to pick up on your body better. You're going to understand these little minute, like, oh, okay, I ate that. Now I'm kind of feeling this way. So you can do a food challenge after that. But for the most part, there's no really accepted mechanism. So, I mean, I can't just say that everyone that tests positive, it's because you eat too much of something. I hadn't had gluten in 8 months by the time I tested. Gluten came up. Okay, so that
Got it.
tells me
That's what I wanted to hear right there.
that tells me
That's
that
yep.
it's a sensitivity. Now
Hmm.
I don't try it. I mean I don't want to push it if it says it, but dairy I feel like I know how much dairy I was consuming, so that I can understand.
Hmm.
Pineapple showed up. I don't eat pineapple.
Yeah.
Hadn't eaten pineapple in 8 months, so pineapple to me is a sensitivity. So it's one of those things that we get the results back, and let's say you're reacting to 7 or 8. In reality, 2 or 3 might be true sensitivities where you will not be able to add them back in. Could be all 7 or 8. It just depends on your body because everyone's unique. Like that's the big thing that I think sets us apart.
Hmm.
It's not just like I was saying earlier, it's, too much of healthcare has gone to just reading what's on the paper, just
Yeah.
reading, you know, all your lab tests came back, so you must be fine. So that's what I do when people call in. So when I do a consultation, consultations can be anywhere from 15 to 45 minutes.
Right.
I try my best. I can be late for additional consultations. So, if anyone ever has to wait on me, just understand it's because I don't like cutting people off.
Mm-hmm.
So at the beginning of the call, I introduce myself. I tell them that I've read their forms because by then you've sent in intake forms. I know what's going on in my head, but I want to hear it from you from start to
Right.
finish. So from start, when did all this start to what has led you up to today where you're so sick and tired of, not getting answers or what has just led you to this point where you're ready to make a change. So for some people that's 15 minutes, for some people that's 45. So while, other clients may have to wait, they have that same opportunity. So
Mm-hmm.
I'm not going to cut them off because I just don't think we're listening to the patient. I don't think we're treating people as a holistic, body. We're just looking at, well, here's your set of symptoms and this is what you need.
Right. Yeah, and few things that I want to kind of add to that too is one, I don't think you can argue with results on that. So anybody that's skeptical about it, and two of the situations you just said, dairy popped up for you, you cut it out, you lost 14 pounds in 2 weeks.
Yeah.
The lady hadn't been able to lose weight in forever. She cut out, spinach and chicken, and she sees results. I don't think that that's something that you can argue with.
No.
And I think, I also think when you look at the food sensitivity test, if you have 8 possible triggers come up, like in your case, it's pretty easy to look at saying the ones, well, these are the ones I'm not eating, so that's probably not causing the problem,
Right.
but I am eating these foods, so it's worth it to try it. And, typically most of the foods I think that we see come up on these things, it's not like cutting them out is going to be harmful. So I think in most cases, it's probably worth, taking the shot at it and cutting it out. But I definitely think that you're right. I think that a lot of times we don't look at when it comes to medicine, we definitely don't listen to the patient. I think anytime I have anybody coming to me, it is always a last ditch effort.
Yeah.
It is always because they didn't get the answers or any answers from their doctors, and now they're appalled by the fact that somebody's actually listening to them and listening to their symptom. And you touched on that last time when we hopped on a call last week. You were telling me how people they're amazed by the fact that like you sit down, and you actually listen to them, and that's not a knock on. I always tell people this. I do not knock MDs at all. I have the utmost respect for them. It's the industry, I think, more than anything. Like for doctors, I mean, they're in a situation now where they have to prescribe certain things for certain situations because that's what's generally accepted, and not doing that can lead to lawsuits. It can lead to medical malpractice. Their hands are tied on a lot of these things.
Exactly.
Doctor, the rheumatologist I talked to last week, the guy's booked out for weeks. He has to see 50 patients a day, and to give them more than 15 minutes is a challenging thing to do. And it's because we load them with that kind of workload. So for anybody out there who is potentially an MD or somebody's an MD, we mean no disrespect. It's the situation that they're put in. You have doctors that are forced to deal with situations that nutrition could probably improve. That's not their area of expertise, and they're not even allowed to, even if it was, they're not even allowed to do things in that area.
I mean, and they'll even tell you. They will even tell you up front that their hands are tied,
Mm-hmm.
that, some of the things they wouldn't want to do. They don't want to put somebody on a statin for the rest of their life, but unfortunately, with current guidelines, if you don't follow guidelines, you're not leading up to that standard of care.
Right.
Right? And the insurance company is huge too. Insurance company dictates, what they're going to pay in. So if you need to make X amount to keep your doors open, you have to see 50, 60 people a day.
Right.
That's the thing. Unfortunately, one of the downsides with food sensitivity testing is that insurance does not cover it.
Mm-hmm.
So it is, cash out of pocket. So for most people, they're willing to do that if they're going to get answers. Some people, I understand it may not be feasible. But that's one reason that it allows me to devote so much time to you, right? So it's a time factor. So, one of the big things within medicine and healthcare now is concierge care, right?
Mm-hmm.
So you'll see it in a lot of big cities, New York, maybe even Tampa, but a lot of the big cities are going to concierge doctors, meaning for $10,000 a year or $5,000 a year or whatever fee that they set, they will be your personal doctor, meaning you get their cell phone number at 2 a.m., you can call with a complaint, they will be there. Because just insurance is running out a lot of doctors. if you notice, finding a primary care physician anymore, it is more and more difficult. Everybody's going to the specialties.
Right.
And that's just because it's the nature of the beast. So I have colleagues who are MDs, DOs, PAs, NPs, all across the board. And it is no disrespect to them. It's just that is their profession. Their profession has a set of guidelines that they need to fulfill. And if you don't do that, you're opening yourself up to a world of hurt in terms of legal issues and you spend all this money to get there, so why would you want to deal with legal issues? Let's just toe the company line, essentially. And so there's pros and cons with everything, but if I still need something, I'm going to, I'll call a buddy who's a PA down in Georgia, be like, do you really think I need anything? Should I go get this looked at?
Yeah.
If he says no, you're probably fine. Good. Perfect.
Yeah. It's nice to have that backup. And luckily we are starting to see a lot more like MDs who are taking holistic approaches, like people like Dr. Lemansky, who, is kind of focusing on biohacking and looking at all the different things you can do to improve your health. And what I think all of this stuff, whether it's biohacking and I think, food sensitivity testing, keto, I think all of those things kind of fall into that biohacking realm. I think it's mostly about taking control of your health yourself. I think a lot of times we do want to just go to a doctor. We do want to just get a pill that's going to make us feel better. And we don't actually want to improve whatever it is that we have going on. And I think sometimes taking the investment for one, whether, to pay money to consult with somebody or get a test done that maybe you can't get somewhere else or that your insurance doesn't cover, I think is the big thing. And then also just being able to follow up and take control of it. I think, I'm somebody who's in a position where I think that nutrition is, a key contributor in everything. I think that, regardless of what disease you have, nutrition in some aspect can play a role. And that's the part that you can control. You can't necessarily control what's going to happen when you go to the doctor's office. You can't control, if they're going to be prescribing you this drug versus that drug and which one is better. But what you can control is what you put in your body every single day. And, to me, if you're somebody, regardless of whether you're stuck at a weight loss plateau, you're sluggish, you don't feel good, you have some health condition, inflammation, like we said at the beginning, is a key contributor to almost all of these things. So if, spending the money to take one food sensitivity test and then getting a game plan for what you can implement into your diet afterwards, to me, that's more valuable than anything else. And I think well worth the money to spend to do so.
Oh, absolutely. I mean, I think that is probably the best takeaway from this whole talk today is you are in charge of your own healthcare. So anytime you go to any practitioner, it can be any practitioner, right? You have to be your own advocate. And there are more and more patients who are doing that. I think nothing against the older generation. I think the older generation were taught, to listen to the doctor, do this and that. And I'm not saying question your doctor in terms of, don't go to WebMD and come in and be like, well, here's my treatment plan. I hated that. And I still hate that. Like, don't tell me that, right? Because I still have a lot of clinical knowledge that you don't have. But with that being said, if you've been to 3 people and haven't gotten the answer that you wanted, keep looking. You're your own advocate. Just because, I tell my students this at the beginning of every year, right? I'm one of those professors who hands out the syllabus. I give them the whole speech about who I am because I think it's important that you know who you're being taught from, right? So doctors are teachers to patients, right? Everyone thinks that we're just, depending on what your profession is, you're just handing out a prescription or something, right? The whole idea is that you teach your patients. You teach your clients. You teach them why you're doing something, not do this, right? And so while I tell all my students at the beginning of the semester, like, look, you should question question the faculty, question them, but don't do it in an argumentative, hateful way, right? I mean, but if you have if you have questions, absolutely, like, challenge it, right? That's how the conversation gets started. That's how you start to understand and build this knowledge base. I think too many people just read something online and bam, that's like, okay, this is what it is, and I'm going to my doctor and telling them that I have, this zebra of a disease that occurs like 1 in every 50 million people, okay, probably don't. Like,
Yeah.
but it's okay to tell him why you think you do,
Right.
and listen to, what is going on.
hmm Yeah, I agree. I think given the if you're talking to a doctor and you don't quite get the answer you want, I think like you said, the biggest thing is just feeling comfortable and asking questions. And if they're not able to answer that question, again, that doesn't mean that's no knock on the doctor. That's just not their area of expertise. If somebody were to ask me right now what my most or like what I would recommend for somebody who is suffering from certain conditions, that's some of those things might not be my area of expertise. I'm going to need to lean on somebody else. So if a doctor doesn't give you the answer that you're looking for, I think, like you said, Dr. James, you just have to go find somebody that does have the answer. I think that if your doctor, if you have a condition, or if you're not feeling great, you have something going on. Like I said, chances are nutrition is probably playing a role. So when you inquire about what are some things you can do nutritionally, and your doctor kind of, if he does brush over it or it doesn't really have much to say, chances are you need to go seek out some other things. And I think that's where people like yourself and other people who, I hate using this term because I think it's taken the wrong way, but like it is holistic medicine. I think a lot of times holistic medicine, people think that that's like these like hippie healers that like
Yeah.
go around and they put
I'm a chiropractor. I get that. Yeah.
right, yeah. You put you in like a sauna, you put some meditation
Right.
music on, and you take some funny supplements, and you're all of a sudden all better. But it is, I think that things like that have given holistic nutrition and holistic medicine a bad name, but that's really what this is it's taking these more natural approaches. There are so many. I mean, when you look at this kind of is branching off a little bit, but you look at like mental health, for instance. I mean, our mental health industry, or like just the medical field for mental health, is a disaster. We have no idea what to do for these people that are suffering from mental illnesses, but we have a ton of tried and true natural, adaptogens and different supplements that we can take to improve these things. There's even a large body of research showing that psychedelics can improve people who are suffering from different mental disorders, and our diet can be a big trigger. Like you talked about the gut-brain axis.
Yeah, the gut-brain axis right there alone, the amount of serotonin that is made in the gut is in the 90th percentile. Right?
Wow,
Who would have thought that the serotonin from your brain actually comes from your gut bacteria? People just absolutely. That's why I said that was probably one of the most interesting classes, because quite honestly, I just thought the GI system was, we break down the food, we get our vitamins, minerals, proteins, carbs, all the stuff, and that's it.
Right.
No, it is so much bigger than that.
And you look at almost any disorder related to the brain, they usually display some impairment in their gut function. Like if you look at, obviously the things like Alzheimer's and autism and stuff we see, but even things like anxiety, depression, and PTSD, we see people, impaired gut function. And again, same thing, chicken or the egg, which comes first? It doesn't matter.
Exactly.
It really, if it's there, and it needs to be treated.
So if you can address gut health, right? I'm not saying you're going to cure all of your neurological issues, but it's sure going to help, right? It's kind of like the inflammation with food testing. Are you going to get rid of the eczema? Are you going to get rid of migraine? Maybe not.
Right.
But it's sure going to improve, by removing that inflammation. So, you said it exactly correct. It really doesn't matter what came first. It's something that we can address, and it can be addressed, so it should be addressed.
Right. I agree. So what I want to do, real quick to kind of finish up here, I don't want to take too much of your time. I know you got class in a little bit to get to, but I want to do kind of like a little bit like fire a couple questions at you and let you answer them. There's a truck going by. I don't know if that's going through. That's the garbage man. I want to just kind of fire a couple questions out, and you can give short answers, 1 or 2 lines on each one, if that works.
Sure.
So what are the 3, and you touched on some of these, what are the 3 most common food sensitivities?
I would say dairy, I would see eggs a lot, and I would say probably gluten.
Gluten. Got it. What are the 3 best foods you can include in your diet for gut health?
Oh, well, I would say a probiotic. Okay. So
Supplement?
Supplement. So supplement was something with broad, so not just one, microbe at a 10 billion level. Okay. I want something that has variety in it, because variety is the spice of life after all,
Hmm.
right? After that, I would say, um, a lot of people hear about FODMAPs a lot, right? So you can cut down on those, but remove sugar.
Hmm.
So it's really
Got it.
not what we're adding. It's more of,
Got it. Can you touch on FODMAPs for a second for people who don't know?
sure. So FODMAPs, so a lot of the FODMAPs are going to be coming from, different saccharides, right? Polysaccharides, disaccharides, things like that. So, a lot of the times what we're eating, and when the gut tries to break that down, um, so that's where you're going to have a lot of issues with, some GI conditions. So you'll hear some people talk about, adding in fermented foods. So I
Hmm.
personally love kombucha. It's not exactly the most keto thing I can do, but every
Hmm.
now and then I'll throw in a kombucha because I just like it, right? It has
Right.
probiotics at the bottom. Um, so that's one thing you can add to that.
Got it. Perfect. Okay. Well, that's good. I really appreciate you coming on and talking about this. Like I said, I think this is something that people, for those of you out there, I guess to kind of put in summary, for those of you out there who are following keto, which the majority of people who listen to this video are probably going to be following keto, you're already doing yourself a huge favor in terms of taking control of your overall health.
Absolutely.
And whether you're stuck at a plateau or whether you are or not, if you're looking to kind of take that next jump and you're looking to really take control of your health and give yourself a better idea, I think food sensitivity testing and getting a consultation with Dr. James is one of the best things that you can do. I think that it can be, for a lot of you guys, it can be the missing factor between, maybe you're operating at 80% maximum capacity right now, but doing this food sensitivity test can be that thing that gets you to 100%. And another thing that we didn't really talk about is we're not just talking about, the way that like your body reacts. We're not just talking about your health. We're also talking about like the way that you feel. I mean, if you're lowering inflammation, your brain's going to operate better. You're going to have more energy. You're going to have your cognitive output is going to be better. You're probably going to train better in the gym. You're going to recover better from your workouts. So I don't think that there's a reason to, like I said, whether you're having some difficulties or not, I don't think that there's a reason not to take a food sensitivity test and see if there's something you can do to improve your diet.
Absolutely. I tell people all the time that, I used to have patients come in and their determining factor whether or not they were okay was whether or not they had pain. I
Right.
mean, pain is a terrible indicator of your overall health,
Yeah.
right? Look at people who have heart attacks on a daily basis. They
Hmm.
didn't have pain until their left arm started going numb,
Right.
and all of a sudden it was crushing chest pain, right? But that's something they've been working on for 30, 40, 50 years.
Hmm.
And so patients used to come in and say, well, I don't have any pain today, doc, so I must be fine.
Right.
I bet you're not. I mean, I bet, there's an underlying issue, because pain is going to be the first symptom to go away. Okay, so as soon as we start working with it, it's the first symptom that goes away.
Right.
And so same thing with food sensitivity. So just because you're eating something that's quote unquote healthy, or that is on the keto diet, or right, chicken and spinach, you can't get much healthier than chicken and spinach.
Hmm.
But if it's something that your body's reacting to, it doesn't matter how healthy it is in terms of the, pop culture. If your body is reacting to it, it's not healthy to your body. So
Hmm.
it's going to cause some sort of the inflammation level. And so that's what we're trying to bring down. So everyone's unique, taking that unique approach, right? That's one reason I love the blood test.
Hmm.
It's, I can tell you to do an elimination diet. I can give you the foods to eliminate. If you want to go that route, that's fine. I think that, I think you do that a lot too.
Hmm.
Of course, I've heard you talk about the plateaus, just remove dairy, see what happens. That's fine. And that's a great starting point. But if you're still not seeing the results that you need, or that you want, or you desire, I think it's because you're missing something. It's
Right.
like you said, if you're 80% now, you don't even know what 100% could feel like.
Hmm.
So even you sitting there at 80%, you're like, okay, well, I feel pretty good. I'm not in pain. I don't have these problems, and I've, lost a little weight, and I've got, some mental clarity back. Imagine what you could have, right?
Right.
There's a difference to me between nutrition, and I try and teach this to my students. There's a difference between nutrition and optimal nutrition,
Hmm.
right? 100% of your vitamin C every day, and I love this one, and I use it every class. 100% of vitamin C will prevent scurvy. Well, congratulations, right? You don't
Yeah.
have pirate disease of scurvy. But is 100% optimal to your health? I mean, you can read some studies where 2,000 milligrams, 2,000% of your is what you need for vitamin C. So at some point, it's not just a matter of warding off disease. I want to take it a step further and go, how optimal can I feel, right? So whether it's
Right.
optimal nutrition, optimal keto, optimal what, I mean, you could just throw optimal in front of anything. And that's really what I try and look at.
Yeah. No, I think you're exactly right. And I think the other thing too is that a lot of people might be a little bit hesitant and want to kind of go away from this type of testing because they're afraid of what they may find. But the truth is really, any food
Oh
that you
yeah.
find, you can probably find a replacement for it. Or, I think that for a lot of people, if they find that, I had somebody tell me the other day that they were, I kind of recommended, they were stuck at a plateau. I recommended cutting out dairy, and they said, if you tell me to take my heavy cream out of my coffee, I'll cut you. Is what they told me. They said, I'll cut you if you tell me to take that out. And it's like, well, what I think you'll probably notice is that if we told you to take dairy out and you did it for 3 weeks and you experienced, if that was the trigger and you experienced the benefits of it, I think you'd probably feel a little bit differently about dairy.
Mm-hmm.
Now, of course, there's some people who are a little self-destructive who, they would rather have, 7 servings of dairy every single day than feel a little bit better. But I think for a lot of you guys, at least giving it a shot is probably going to make you feel a little bit better about that. And like for me, I know that if I found out that eggs were a trigger for me, that'd be really hard for me. But I eat a lot of eggs, so if they were a trigger for me and I cut them out, I'm sure I'd feel so much better that I would be pretty okay with cutting that out of my
Mm-hmm.
diet.
One thing, it's funny you said that. So, oftentimes I try and take a practical approach to this, because quite honestly, the testing itself is the easy part.
Yeah.
If I come back and tell you that you're reacting to eggs, that's the hard part for you. Like, you have to make that conscious decision of, am I going to remove this? 3 weeks, 3 months, 6 months, whatever it is. And so the testing itself is what I think is the easy part, right?
Mm-hmm.
So we'll have that call, we'll have that follow-up call. If it's something that you really love, I try and take a practical approach. It's not the most optimal approach, but it's a practical approach, right? So let's just for instance, your eggs came back and you eat two dozen eggs a week, right? So 24 eggs a week. If you cut that in half, if you just went down to a dozen eggs a week, do you not think you'd see some sort of improvement? Or, if we cut those down to 6 eggs a week, that's 75% reduction. Do you not think we'd see some sort of improvement? And so while I tell people that's not the optimal approach, it'll be a slower approach. But if it's something you absolutely can't live without, right? It's one thing to spend the money for the test. It's another thing to do nothing with it.
Mm-hmm.
So if you're one of those people who is, contemplating like, hey, I really want to get the testing done. But if you're one of those people who at the same time knows that you won't follow through, quite honestly, I'd tell you, save your money. I mean,
Right.
I'm happy to help. I'm happy to do the consultation. I'm happy to talk to you. But again, the testing is easy. It's just a matter of, can you remove those foods? And so I like to take that practical approach. I had one lady who, this will be the last story I'll tell you. I had a lady one time. She'd gotten her results and it was just kind of crazy, right? she was getting ready to go the next weekend down to a wedding in Mexico.
Mm-hmm.
A once in a lifetime trip, right? Hopefully it's a one and only marriage. Lifetime trip, you're going down. I said, don't worry about the food. She goes, because, it's an all-inclusive and they're going to have all this. I said, don't worry about the foods. I said, none of these foods that you're currently eating cause, the anaphylaxis or cause the major immune responses. So you're just going to keep feeling the way you're feeling, but it's not catastrophic.
Right.
And so for, clients to understand that there is a practical approach to this. I don't make special requests out at restaurants. I don't say, okay, I can't, if I see cheese, I'm going to send it back. No. If I'm at a nice restaurant, send it however you do it. A lot of people these days are reacting to garlic. So you're asking earlier about garlic, and the last 4 tests I've had, they've been all garlic.
Wow.
That's been a surprise to me, but, I'm not going to ask the fancy Italian restaurant or wherever I'm at to, please don't put garlic. And if I even smell garlic, I'm not going to send it back.
Right.
It's not to that level. And so for people to understand that you don't have to make drastic life changes, right?
Mm.
I think is a more solid approach for people.
It's all about making it a lifestyle instead of a diet, right?
It is not a diet. It is a lifestyle. No matter what you do, I asked class the other day what a diet was, and they said it's when you're trying to lose weight, right?
Mm,
That told me exactly what I needed to know about it.
yeah.
Everyone is on a diet. It's my diet of eggs and beef every week, right? That's a diet. My keto, it can be a diet, but it's not a diet in the terms of you just do it to lose weight, right?
Right.
Here's my lifestyle. My
Hmm.
diet is my lifestyle.
Right.
So
I'm with you, man. I agree with that. Well, I love that, man. So can you tell everybody where they can learn more about you, or if they want to see more of your work or contact you for consultations or anything like that?
absolutely. So I'm on Instagram. So at Dr. James DC. So Dr. James DC. I'm there. I am also online. You can go to www.drjamesdc.com. Um, you and I, we're going to start working together and come up with something for, all your listeners, all your followers. So, that's to come. So you can check back. I'm sure, you'll provide them with a link and everything.
Yeah.
But if you just wanted to start those two places, Instagram, you can see some good content. A lot of the stuff, I share nowadays. I share a lot of stuff from, I share a lot of stuff from, some of the other places out there just because it's those tidbits of information that I was saying. Like, you
Hmm.
know, while I have a lot to contribute, these every now and then they catch my eye, and I'm like, people got to know this, so I'll just
Right.
submit that. But yeah, so check out the website, check out Instagram. On the website has all my contact information, my email, and a phone number that people can contact me. Email's best. That way I can send you over your intake forms and an inflammation questionnaire, so that I can gather some information before we talk. And like I
Perfect.
said, I will read all of your intakes and information before I talk to anyone. But that phone call is going to be all about you. So, um, you know, be prepared to talk.
Yeah. Awesome. Well, thank you so much today for taking the time to explain this to everybody. Guys, definitely give Dr. James a follow. And if you guys have stuff regarding food sensitivity, if you're interested in some of his services, contact him and be on the lookout for more exciting things coming from me and Dr. James. So thanks a lot, guys. I appreciate it.
Take care.